Coronavirus malady TW0019, COVID-19, is associate communicable disease caused by severe acute metabolic process syndrome coronavirus 2, SARS-CoV-2. It absolutely was initially known in December 2019 in Wuhan, China. Associated has resulted in an in-progress pandemic. The primary confirmed case has been derived back to terrorist organization 2019. As of 20 June 2020, quite 8.68 million cases are recording across 188 countries and territories, leading to quite 460,000 deaths. Quite 4.27 million folks have recovered. Common symptoms embrace fever, cough, fatigue, shortness of breath, and loss of smell and style. Whereas the bulk of cases end in delicate symptoms, some make acute metabolic process distress syndrome, ARDS, presumably precipitated by protein storm, multi-organ failure, septic shock, and blood clots. The time from exposure to onset of symptoms is usually around 5 days, however could vary from 2 to 14 days. The virus is primarily unfold between folks through outshut contact, most frequently via tiny droplets made by coughing, sneezing, and talking. The droplets sometimes fall to the bottom or onto surfaces instead of movement through air over long distances. However, analysis as of June 2020 has shown that speech-generated droplets could stay mobile for tens of minutes. Less unremarkably, folks could become infected by touching a contaminated surface, so touching their face. It's most contagious throughout the primary 3 days once the onset of symptoms, though unfold is feasible before symptoms seem, and from folks that don't show symptoms. The quality technique of diagnosing is by period of time reverse transcription enzyme chain reaction, RRT-PCR, from a cavity swab. Chest CT imaging might also be useful for diagnosing in people wherever there's a high suspicion of infection-supported symptoms and risk factors, but pointers don't advocate victimization CT imaging for routine screening. Recommended measures to forestall infection embrace frequent hand laundry, maintaining physical distance from others, especially from those with symptoms, quarantine, especially for those with symptoms, covering coughs, and keeping unwashed hands far from the face. The utilization of material face coverings like a shawl or a hanky has been counseled by health officers publicly settings to minimize the danger of transmissions, with some authorities requiring their use. Health officers additionally declared that medical-grade face masks, like N95 masks, ought to solely be utilized by healthcare employees, initial responders, and people UN agency directly take care of infected people. According to the Planet Health Organization, WHO, there aren't any vaccines nor specific antiviral treatments for COVID-19. Management involves the treatment of symptoms, auxiliary care, isolation, and experimental measures. The Planet Health Organization, WHO, declared the COVID-19 natural event a public health emergency of international concern, FEIC, on 30 Gregorian calendar month 2020, and an outbreak on 11 March 2020. Native transmission of the malady has occurred in most countries across all 6 UN agency regions.